Now, I think if you do some reflection, we'll be practicing medicine, and the medicine is changing a lot in this era. If we don't change, we will be changed. And certainly, if we do some reflection, more than 2,000 years ago, in fact, all disease begins in the gut. Now, there's a lot of data to show that even Parkinson's disease, there's an alpha-synuclein that actually deposited in the bowel before the manifestation of Parkinson's disease, and many more. I think we are getting better in terms of having the knowledge about what are the real function of the gastrointestinal system. Now, if you look at the gut, I don't want to give you a lot of fast facts. Suffice to say that it's about 10 square foot. It's a second brain for us, and 95% of the happy hormone released by the gut, serotonin, not in the brain. If you exercise, you get a lot of happy hormones, and no point to be sad. And there are many functions, and in fact, there are a lot of microbiome population, or so-called living creatures, or makhluk halus, living in our digestive tract, and these are the ones that have a lot of connectivity with many parts of the organs. To name a few, the gut brain exists, the gut liver exists, skin exists, there's so many. And they are very complex of networking between the microbiota or microorganisms that actually living in the digestive tract, and they actually determine overall of our well-being. So normally it's about 80 to 85% or so, the microbiota or the bacteria, predominantly virus, fungus, archaea, and so are the good guys, the good little creatures living in our digestive system. It's about 20% or so the bad guys, but they do not disturb our bodies unless your immune system is low, unless you be diagnosed with cancers, unless you have been treated with chemotherapy, radiotherapy, where they can behave like an opportunistic pathogens to start tackling the system. But overall, we need to maintain this kind of equilibrium in our body. And it's a very complex system, and you can see a lot of tight junction that adhere the intestinal epithelial cell, the gap junction, tight junction, so that all these pathogens or the toxin or the toxic waste product that we consume do not pass the barrier, initiating the cascade of inflammation, neoplasia, so and so. So if in our daily, we are 2025 now, you imagine, let's say 100 years ago, how we eat, how we behave. We don't have, Wi-Fi started in 1995. You imagine without the Wi-Fi, the first time you got Pegasus mail, last time feel like, wow, So you imagine 100 years ago, how we behave, different level of stress, different level of purpose, so that our immune system is very well trained. Nowadays, the kids wake up with a hot shower, tea and toast, westernized diet, immune system is not relevantly challenged. You imagine that, and they easily develop autoimmune disease over the time. So all this lifestyle or whatever that we behave will lead to so-called a leaky gut, where the tight junction, gap junction, adherent junction is not as function as good like many years ago, or we are living in the different environment. And as a result, there's a pathogen, there's a toxic, they're passing by to the leaky gut or to the leaky junction, so that they can start to attack and trigger a lot of inflammatory cascade in the human beings. And this process will take years and years. It's not like typical chest pain and heart attack. Years and years, the integrity of the junctional barrier is breached. Then they consequently develop a lot of immune system autoimmune diseases, whether pernicious anemia, rheumatoid arthritis. I'm sure if you've been practiced long enough, you have seen a different landscape or disease paradigm change in your clinic. Asthma, rather than like before. I can give you an example. One of the medical students asking the rate of cesarean section. When I was a student, when we were a student once upon a time, the rate when I did the audit is about 2 to 3%. But nowadays, I can guarantee the rate of cesarean section may be 60, 70%. The mom wants to have a baby the same birthday like the husband or herself. let's have elective cesarean section. You know, and this influences the composition, density of the gut microbiota when the baby were born by cesarean section. And straight away, bottle-fed, processed or ultra-processed food. Do you not know that 60% of the calories that we consume are coming from the processed or ultra-processed food? These are very toxic, both at the animal and the human model. So something that we need to wonder. So all this dysbiosis or the equilibrium is disturbed, severely disturbed because of many factors I told you, and leading to a lot of diseases that manifested nowadays in the 21st century, ranging from non-communicable diseases, infectious disease, cancers, or many other chronic inflammatory or non-inflammatory diseases. So let us go to microbiome-based therapy. People will always ask, what is the probiotics? I mean, the simple definition by World Health Organization is probiotics is a living microorganism, predominantly bacteria. When we consume, they administered to us, it confers the health benefits. But I can guarantee you, if you go to the pharmacy or any shop to ask probiotics, the pharmacist will give you maybe 20 or 30 choices. As a consumer, we will look at how much is it, how to store, where to store, is it multi-strain, multi-species better? The higher the dosage, the better. So something that we need to educate ourselves. Now, I'm not going to bore you because this is integrative medicine. Also, I've been learning about this for the last couple of years in terms of conventional and traditional mix, the cutting edge. If you look at from previous dynasty, Ming or dynasty Jin, if you follow up how the yellow soup, if you Google the yellow soup, the feces that we use to treat acute gastrointestinal gastroenteritis before. When soldiers fighting one each other, they got bad environment, they got infectious because overcrowded, they were asked to drink the yellow soup, which is yellow poo. That has been described very well. And this is actually the landmark for the development of fecal microbiome transplantation. Ladies and gentlemen, our poo now is very expensive. How do I know you produce the super poo or you are the super donor? I will tell you the secret. So over the time, when we look at the probiotics, even the terminology by colors, and then various platform cutting edge research, not only sequencing, many other techniques, modality that we use, and come up with a name, not scientifically proven the use of probiotic in clinical practice. There's certain element that we can use. So these are the way, the natural history, how the probiotics can potentially manage the diseases. Now, if you look at, for one example, TCM, or traditional Chinese medicine, if you look at yellow emperors in a canon, the elements of wood, fire, earth, metal, and water. If you look at this side on the left side of your diagram, there are features how these, what we call this traditional way, compared with conventional way, and the what we call this cutting edge research project, essentially telling us how these probiotics support the organ system, how they harmonize in our body, and how it reflects the holistic approach. I was in the West living for more than 2 decades in certain disease, in particular, for example, multiple sclerosis, where at that time we used a beta interferon, no monoclonal antibody. A lot of patients actually went to the Eastern Europe to get the integrative medicine for their spasticity, for their many other features, and some of them we see work very well. And of course, above all, gut health is a very important foundation for the overall health being. You'd imagine yourself, if you got constipated, if you get diarrhea, you actually feel anxious, feel depressed, and no wonder if you look at in the psychiatric ward, a lot of biological symptom or depression among psychiatric patient is constipation, because of overloading of the stool that release all the bad gases and create all these manifestation of the symptoms. Now, so how many probiotic supplement in the world at the present? If you Google whatever search engine that you're doing, you want to ask ChatGPT or DeepSeek, you are welcome. But at the moment, from the last many years, There are 600 plus or different types of probiotics. And the good thing is that for the next 5 to 10 years, the Chaga cumulative annual growth rate is 10%, bringing the market value around, you can see there, over 100 US billion everywhere in the world. So please start to buy the share for probiotic from today, ladies and gentlemen. Now, so how to choose the probiotics if you go to the pharmacy? Probiotic, we have multi-strain, multi-doses, multi-species. It doesn't mean that it's actually better than single strain. And it's important to know that the quality of probiotics actually depends on the proven efficacy from the clinical randomized point of view. It's not just the number of the strain, and it has to be proven at the randomized clinical trial. I think we all learn from the medical school, RCT and meta-analysis is on the top of the pyramid where we should believe rather than a report, case series, so and so. So if you look at, for example, the product A having this strain and proven efficacy and safety and efficacy, bang, should say that combination is working, as opposed to, let's say, formulation of different strain, creating the product, undergo a very thorough clinical vigorous studies. I've been doing randomized clinical trial for many years. It's very headache. It's not easy because the result can be shocking, the result can be very exciting, the result can be very demoralizing. So very important for the sake of our patient. Above all, safety and efficacy is paramount to our customers or our patient. Now, shall we be cautious? Of course, it has to be supported by evidence base. In God we trust, the rest need data. If we don't have the data, you keep singing a song, whatever that you prescribe, you do not do justice for your patient. Money is tight nowadays. It's not fair for patient to spend supplements, something that's not proven clinically. I think patients are very appreciative nowadays if you talk about the data science. Now, again, without the data, I'm just another person to talk. Whether you want to agree or not, it's not my problems, but it's not good. We have to have the data to support the studies. Now, look at this best evidence, selecting the right probiotic. And there's no doubt at all in this era. Even if you ask the ChatGPT or DeepSeek, they do not have, because they're waiting for us to feed them the information. So they will not say which is the best probiotic that you can prescribe to your customers. They also rely on the data. But if the data is false, or it's not positive, or it's neutral, they will say that it's not effective. And that's why the guideline is important. Guideline is a guideline, but I think for us to follow as close as possible is very, very important. There are many evidence-based at the moment, there are many trials and many diseases, and actually most important is what evidence that show that it has to be supported by big science, not pseudoscience, or real science, and tested. People in Britain respond differently because pharmacogenomic, pharmacokinetic, pharmacogenomic are very different. The way that we eat are very different. And of course, when they are published in the literature, reviewed by peers, who are expert in the field. So you will not get nonsense in the review, and you get a lot of headache to rebut whatever that they ask in the publication. And of course, in this context, Hexabio have a 6 strain and 3 species, the one that I do trial for the last many, many years. So I think to summarize the Hexabio, what we call the elements, the 30 billion CFU, a colony forming unit, is like the dose, milligram or nanogram of the, and different preparation, palatable, granules, and contain of a 6 strain and 3 species for your information. And Hexabio has more than 20 randomized clinical trials, and I'm not going to show you all this evidence. I'm going to go one by one in the application of clinical practice. The first one in the elderly patient who has constipated. I'm sure you get a lot of aging, healthy or non-healthy patient. We all aging. By 2030, 15% of Malaysians will be 60 or above. These are the market in the future. And what we have shown that taking Hexabio twice a day increased 50% of stool frequency, relieve majority of the patient from constipation, and ultimately improve quality of life. These patients have diabetes, hyperlipidemia, heart disease, kidney disease, a lot of painkillers, and they are not eating as good as us. Their fiber intake is very poor, their fluid intake very poor, so they need actually to have a lot of good bacteria into digestive tract to improve their digestive health. And we also have seen that in population, for example, in Parkinson's disease, with Professor Nolina, a neurologist at UKM, we have shown a lot of a very outstanding result, 38% of reduction of gut transit time. What does it mean? Mean that if we eat today, by 42 hours, everything not be absorbed, excreted through the feces, but some people have prolonged transit time, like we waiting the flight in the airport. So they have constipation. So we need to reduce that transit time. That's a way how we measure that, ask them to swallow this and that. As it's proven very nicely, the transit time reduced by 38%, increased the bowel movement, and again, for those who have chronic constipation, frequency of stool will be improved, and constipation alleviated in more than 30% of the patient. What about fatty liver? Again, we are champion, the most obese population in the ASEAN. Two students, clinical masters and master of science student, Aina and Nizami, have shown very clearly that taking Hexabio actually alter the cell at the gut-liver axis. Not only they restore the gut bacteria balance, they strengthen so-called barrier, ZO zonal occludent type 1 junction, they stabilize immune cells, CD lymphocyte, and more importantly, they reduce inflammation in the liver. Hepatitis means inflammation by virus, by fat, so and so. And inflammation actually causes cancer a lot, 20 to 25% nowadays. So you can imagine taking how this gut liver exists that we can modify to reduce all this inflammation and change the population of the gut microbiota. And we actually attracted a lot of citation on this paper, and it's not easy to do because we analyze up to the CD4 lymphocyte. I keep telling the doctors nowadays, if you go to the work round, if you just only thinking full blood count, CRP, renal profile, HbA1c, these are the work round 100 years ago. You know, we have to think about molecular level, RNA, DNA, protein expression. If not, we are not different compared to 100 years ago. So obviously a very, very different game of medicine nowadays. So we can protect, and certainly in my practice I'll be using for patients, especially those metabolic syndrome. Type 2 diabetes, again, with the National Health Mobility Surveys, and this in conjunction with Prof. Azmi, endocrinologist, clearly have reduced the HbA1c, also certainly reduced the fasting insulin level, and ultimately also there's some data to show the improvement of the kidney function. What about overweight? This is another disease, another issue, and interestingly, when we give the probiotics, they can actually reduce about 285 kilocalories per day. Of course, endocrinologists will say that there is repulses, we probably use a lot, but again, is it very cheap? You tell me, what are the side effects? Is it nausea, vomiting? It's nothing wrong, it's proven. But some alternative medicine that you want to give. Now, when I heard the word integrative, I remember my mentor used to say to me many, many years ago, we are talking about work-life balance. I think we listened to Amanat President just now, right? So now you're talking about not work-life balance, work-life integration. How we integrate life actually rather than balancing. So it's proven nicely that reduction of the calorie intakes for taking only 4 weeks supplement of the Hexabio. Again, the similar more or less design studies taking the Hexabio, this time longer than the first one. Again, reduction of about 30% of the fat intake and 388. But what it means that the longer the consumption of probiotics, the higher the calorie that we can inhibit from taking whatever food that we consume every day. What about ONG? So we know that I'm sure you see a lot of post-gestational diabetes. Women, we got pregnant, they got diabetes. Many of them after delivery, they continue to have diabetes as time goes by. So how do we modulate the gut microbiota so that we can prevent the onset of type 2 diabetes against women? So we're curious about this, and we perform clinical trials, how we think that we hypothesize that we improve the gut microbiota. First of all, pregnant women, when we take the stool sample, their microbiota composition density are very different, and they are like a person who has type 2 diabetes, ladies and gentlemen. The same thing if I take gut stool sample from the obese individual, your gut microbiota composition is the same like type 2 diabetes. So we have a point to say that can we improve gut dysbiosis by manipulating gut microbiota, by installing the good gut microbiota, and we measure using all this fancy platform to see that, and we also measure short-chain fatty acid, which is very important metabolomic products of microbiota, and we have seen reduction of components, HbA1c, fasting glucose, even high sensitive CRP, and we prove that it is reduced the risk of type 2 diabetes. So something that we do not expect, we also surprised. These are the beauty of performing clinical trials using the probiotic in this setting. So I think getting also attention. What about the menstrual pain? We collaborate with Prof. Azura, a gynecologist in HUKM, in terms of period study. We give a supplement of the Hexabio about 3 months, and in fact, there's an improved not only mental score without the side effect, but great reduction of consumption of the NSAID for the period pain, and also relieving the associated bloatiness and also diarrhea. So this is actually a quite surprising finding for us, because I have no idea the pathogenesis of the menstrual cycle, but I think we address this issue for primary dysmenorrhea, and it works very, very well. What about colorectal surgery? Now, this is a study done some time ago by Prof. Chin in the have looked at the reduction of the inflammatory cytokine interleukin-6 in patients with colon cancer. So by giving the probiotics, you can see that up to 40%, and also relieving the side effect related chemotherapy for patients with colorectal cancer. So something that we think, patient got cancer, immune system is low, you're giving live microorganism, you susceptible to infection, which is not right, which is no data to say like that. So something that outstanding. And then we got Liana, the master student, to perform the first time randomized double-blind placebo, taking Hexabio for those who get colon cancer. To our surprise, all the cytokine, TNF-alpha up to IL-20T, significantly reduced after taking probiotic, suggesting that there will be preventing from the recurrence for this patient. But we do not measure after we stop the probiotic, but this is a very shocking data for us, and it attracts many citations from other researchers doing probiotic in colon cancer all over the world. Something that we need to learn from the lesson, and we put in the discussion potential immunobiotic. Of course, there's no biotic requires, no infection, and actually no worsening diarrhea. What about nutrition and ICU? Again, Prof. Chin had looked at the pre-surgical administration in terms of taking the probiotic Hexabio, 35%, a much faster recovery, return the function to normal gut function, the bowel function, so, and importantly, also the calorie intake and nutrient absorption in the study, and leading to early recovery and save the money for the shortened hospital stay. And again, in the clinical trial, critically ill patient, you can see improved feed intolerant to ICU patient, duration of stay, and also the return of the gut function for this patient. So it excites a lot of people in terms of finding locally. We still have what we call this data from overseas, yes, but we should showcase the data that are available in Malaysia that has been published in a very high impact journal. I think attract attention to many media in terms of probiotic manufacturers in Malaysia, and has produced a lot of breakthrough results and become top choices in many hospitals and winning a lot of awards for the last many, many years. And certainly the first time I heard this probiotic was in Jakarta, outside Malaysia, in 2014, So I think something that we should be proud of. And ladies and gentlemen, for quick summary, gut microbiome is not a new player. It's been there for many, many years. They are the root cause of many diseases, are the non-communicable or non-communicable. and then this biosis causing a lot of issues, diseases, and how we do correction or manipulate the gut microbiota by having the gene therapy leading to healthy gut microbiome and improve ultimately quality of life of the patient. And I think these are the set of the books me and colleagues have written to give the guidelines to consumers, healthcare customers. Nowadays, I will not call them patients because some of them are very healthy. They are healthcare customers. So our job is to maintain their healthiness. What do they need to do? So we give the guideline in terms of how do they take, what the right choice and the best choice for probiotic consumption. And we also have all these myths and facts about probiotics, what are the things that they should know or not. And with that, I thank you so much. I'm happy to take any question.